Hi everybody, good evening. I have gone very professional this evening. I have a light, but I'm not sure if it's placed properly, but it feels really strange. Nice to see you all. I hope my internet is cooperating tonight. I have had huge problem with my internet. It doesn't help that the rest of the clan here are on their laptops. I have been screaming, get off your laptops, get off your internet. So hopefully we can have a nice chat. Tonight I'm going to speak to you about Botox. Any questions you have, just ask me. I am going to go through some basic things and just some myth and some questions and some things that people normally ask, the frequent asked questions, everything that I can think of and anything that you guys can think of. This light is really strange. I just want to turn it off. I also have a very special friend that I've invited, which is going to help me to demonstrate, and hopefully it makes things a little bit easier when I have a little bit of help in terms of injection points, because a lot of people ask me, does it hurt and where do I get injected, etc. So my friend here is going to help me with that. So basically Botox is a muscle relaxant. It's not designed to remove lines, although we do use it for removing lines, but it's not designed to do that. Botox is designed to freeze the muscles that are responsible for creating the lines. Now, if it's your first time having Botox and you have some deep wrinkles, this doesn't obviously smooth things out straight away. You need a few goes. You need to not make that movement for a little while, depending how deep the lines are, and then eventually it will soften and smooth out. Some lines doesn't, but basically depends how early stage have you started. Did you start as a preventive, or did you wait until in your 30s or 40s or 50s, depending. So it's a lot of things that needs to be discussed. The most frequent questions for people who never tried it: will I look frozen? I don't want to look frozen. I don't want to look natural, which is fine because that's not my approach anyway. And I always start very, very gentle. I always start with perhaps even advising against injecting the forehead, because you still will have nice movements. It's almost like tricking people, really. If you inject places that are very obvious, injecting the forehead will be quite obvious because your forehead freezes. But if you are over 40 and you have a small forehead, or you've never had Botox before, I would say injecting the forehead is not a great idea, because we want to get a nice lift. But injecting the forehead will actually droop you down, which is not the thing. It's not what we want to achieve. I think if you are over age of 40 and you already have created quite deep lines, then it's something that you really need to work with, just to put up with, because trying to address those is just going to make things, it's just not a great look. It will look heavy and you will look quite droopy. Injecting some muscles that are going to lift you, because with age we all get quite saggy, heavy eyebrows, so it's good to inject the muscle that is going to give you a nice lift. Now, you are not going to have a facelift, but a couple of millimeters sometimes is going to make a huge difference. In terms of my own forehead, I can't have any Botox in my own forehead because I have very sensitive and weak forehead muscles, and my eyebrow droops down and is not a great look. So for me, as you can see, I still have the movements, and this light is very strange, but if you see me in the daylight, you'll see that I have lines, which I'm happy with, because I'm 46 and I will have lines. Now, people ask me, what is 3 areas? What is 4 areas? Which areas should I be injected? I'm going to go through some basic things that if you have had Botox and you're committed to it, then you know already what I am talking about. But if you've never had it before, then it's quite daunting. So I think it's important that we go through some basic things. I think Botox is sometimes very important that you don't think about lines too much, and you think about Botox can also, instead of addressing the lines, can also lift, which in some areas can actually be quite handy, such as the droopy mouth corners. It's actually quite nice. I'm going to show you shortly with my demonstration. Now, also, it can be quite, it can be used as a clinical, more medical approach, such as headaches and migraines. I've had very good results with that, but that's less of an aesthetic purpose. But it has been proven to be quite successful. Thank you. I'm looking forward to see her. How lovely. So I have I get asked, I think years I've been practicing, I have learned to understand that I'm not for everybody, and some patients, those who are striving for frozen foreheads, are not the sort of patients that come to me, because I don't like the frozen look. I advised against it. I don't even feel comfortable injecting people, so I tend to have more of a natural approach, and patients who comes to see me, they don't expect to be frozen. And it's important also to understand, this is one of the very frequent questions that I have. After perhaps around about 6 weeks, people say to me, I think my Botox is wearing off, it's not there, I'm melting. But you have to also understand that the effect of Botox, it doesn't last for the entire 12 weeks. You start having muscle recovery, which is muscle movements, from about 6 to 8 weeks. That doesn't mean the Botox is gone. It means that you just have movement starting again, and then eventually gradually gets less and less until it wears off at around about week 12. Other questions that I have is, if I have more Botox that I have, will I need more? But you tend to be, if you are committed to it, and if you are one of those people who have it, I don't know, 3 times a year, I think eventually you need it less, because your muscles getting used to it, and they sort of understand the movements. If you are a huge frowner, then you get used to not to frowning, which it does help. Now, if you have too much, and there are some cases when people get quite immune to it because they have it too much and it start not working as much as it used to do, that's also something that you have to bear in mind. So if your injector tells you actually you're not due for injections, then that's obviously an honest injector, and there is transparency there, and it's a good thing if you are advised against it. It's just no point to keep having that for the sake of it, because it's if you don't need it, you don't need it. Some areas, for example, if you have quite a large muscle in the middle here, and you end up with a very deep dented lines, some people call it, obviously it's a frown line. I can't remember, there is another name people call that. My 11s. So those people, it can actually look quite harsh for the face. So it's good that those areas are addressed. That can be but you need to have that area quite relaxed and frozen for a long amount of time before the lines get softened. Now, I have asked my very good friend, this is my new resource, Rapunzel, is going to help me, because seriously, this is really good, because I couldn't get one of the children to do this, but Rapunzel here will be super super good, and let us show you some injection sites. This is my 6-year-old's toy, and she wasn't very happy that I borrowed it. She said to me, Rapunzel does not need Botox. Seriously. She was worried. Now, I'm going to show you where we inject. If Rapunzel comes to me and Rapunzel asks me, sorry, I just had some technical issues there. There you go. Thank you. Right, okay, so she's obviously quite rigid at the moment. I'm just hoping that I'm not going to break her. Seriously, my 6-year-old will not be happy. Okay, so we're going to talk about Rapunzel's frown line, which one of the most popular areas. Hold up, there you go. Is that better? Great. So, on Rapunzel, one of the most popular areas for injection is the frown line. So I'm going to show you where I would inject Rapunzel if she comes to me for matter of frown line. So we will pinch the muscle here, and we will do an injection site there. I also would inject the eyebrow here, because this muscle on each side is responsible for your frowning, and that muscle needs to be frozen so Rapunzel doesn't frown. We want to have that for a long period of time. She needs to not to frown, so that will eventually soften. Sometimes we inject here, which would give also a beautiful lift. Now, depending if Rapunzel have already a beautiful arch, which she does, then we also don't want to have that doctor spot or a lot of lift, so we leave that muscle alone. Another area that we will inject is her forehead. Again, this is an area which I'm not super keen on, because it actually can make it quite heavy and quite frozen looking. But sometimes we inject this area, and also depending on the muscle movements, depending on where you need it, and I will assess that by looking at you and your movements, where you how you move your foreheads, where the muscles are. We do a couple of tests to see if the muscles are not perhaps weak, because sometimes if they are, we will actually not inject that area. So injection site can be anywhere. I mean, obviously Rapunzel have quite a small forehead, so if she came to me, I would actually advise her not to have any injections in the forehead. Now, if you look at the crow's feet are, it's very much different between crow's feet and smile lines. And this is a very, very important matter here. The crow's feet are if you don't move your cheeks and don't smile with your cheeks like that, but leave and be very still, but only squint like you look into a bright light, only squint with your eyes, then the movements on that muscle will create what we have is a crow's feet. On the crow's feet, if it's too much, that can be softened and that can actually look quite nice. But if you are smiling with your cheeks, you can actually, I want to watch, but the dawn is too weird. Well, it's educational. But actually, smile lines, I would also very much advise against removing the smile lines, because then you actually look really weird. So this is the area that I inject, 3 injections just around this area, and that is what we call a third area, which is crow's feet. Other areas that you can have Botox is, I mean, she obviously have a beautiful smile and is quite upward, but if you are quite still and you get this quite sad, droopy mouth, is a very good treatment to have, which is, I don't know if you can see, this area can be injected and it will lift the corners. Other areas that I inject, it could be dimple in the cheeks. I'll just give her a beard. Bibi's not going to be happy. So for the dimples and that orange peely chin, I think is a very good, it can look quite nice and smooth. If you stand in the mirror and you do this movements, and you can see it's quite orange peely, Botox can smooth that area. Another area which is we inject is for resting. Yes, she's aware of that. I was not going to say resting bitch face. I was going to behave. I don't know, it's the hand. Yes, I can't get the hand down. It's just very, yeah, I don't know. Okay, ignore the hand. Masseter, which is one of actually strongest muscle in the body. Masseter is the big muscle in this area that you chew with. Now, masseter is responsible for obviously chewing and other areas, to put pressure, and based on the weight that you can that you put on your food and on your teeth, is actually a very, very strong muscle. So injecting this area, which is the masseter muscle, prevents you from grinding your teeth together, and is an amazing it would be amazing for people. This treatment is a very popular treatment for people who grind their teeth. They break their teeth. There are some severe grinders that break their teeth even. They get headaches, they get problem with the jaws and clickiness and all of that. So it's an amazing treatment, and is also slimming the face. We use it for if you have quite a strong jaws, that it actually quite it makes your face slimmer. I'm quite distracted by people's comments. Right, masseter. I also do injection of Botox in the neck, which I think is an amazing treatment. At the moment, I need my neck done, and this is one of the nicest treatments that I have. For me, it is very anti-aging. I think we can put her away. If I do that, can you see the bands? And this is something that obviously it's very it comes with age. And when you say strongly, oh no, it doesn't hurt. It doesn't hurt. This is great, because I'm going to explain this and I'll take your questions. These bands can be relaxed, and what we call the the neck lift. Once these are injected with Botox, it can look beautiful, and it's very smooth, and it can give a very young looking neck, and it's also can be sometimes used for jowls in this area. So depending how much you are used to it and how much treatment you have done previously, I mean, you can't expect miracles at first, but that needs to be assessed with your injector and your expectations managed and all of that. But I think, you know, sometimes even patients come to my clinic for Botox, and I feel that's not going to do much at that stage, and perhaps they should be open to the idea of starting with fillers, again depending how much your previous experience has been with treatment. No, it doesn't actually hurt. I mean, look, I would say the needles that we use are super tiny and super thin, and they are just a little scratch. So it's important that don't have the pain to put you off, because it's not painful. So on the neck, I will grab the bands. If you can have a look here, I grab the bands and I will inject the bands. Again, it doesn't hurt, but it just gives you a very smooth. It actually quite. When I had it done first time, I didn't expect it to love it that much, but it was actually quite anti-aging, and I love the effect of it. Questions, that would be, I think I missed quite a few questions there when I was injecting Rapunzel. So frequent asked questions, how often do I need to have Botox? I would say depending again on your age and your previous treatment, I would say between 3 to 4 times a year. Sometimes you don't, if you are much younger, maybe you just need, as a prevention, maybe just need twice a year. It's not great to wait until the entire Botox has worn off. It's great to just do as a matter of topping it up. So don't wait for the injector to start all over again. Perhaps just go back before it's completely worn off. For that, I use, for horizontal lines, I love to use skin boosters. That's very efficient and have better result than Botox. Reaction to Botox? No. There are some things that can happen. You can bruise. I mean, as an injector, I can't ever guarantee that you will not bruise. You can have the droopy eyebrows, the droopy lids, that can happen. But again, if you are assessed properly and injected carefully, you have to, that can be avoided. But it can happen, and it has happened to me. Not so much anymore, but it has happened to me. Other things that can be a side effect of Botox, I would say, that is quite important to remember that bruising is one of those things, trying to avoid alcohol before you come in to see your injector, trying to maybe take some arnica beforehand. A couple of days before your injection date, it's a very good thing to do in terms of bruising. Again, it's important that you remember, I mean, it is important that you remember your injection around this area can actually bruise, sometimes forehead as well. Around the crow's feet, it's a little bit more risk of bruising, but again, it's very important that if there is a good lighting in the surgery, and if you have bruise on that area, if you want your injector to say, I tend to bruise here, please be careful, because that is something that is good for the injector to know. Injection site for migraines, that is for another session. I will go through that for medical purposes. I will have another of these live to talk about that. That is definitely super interesting, and I think treating headaches with Botox is an amazing effective treatment. Do you feel on the same day? Do you mean if you can have fillers on the same day? Yes, same treatment day, the same day as your Botox? Yes, of course. Absolutely, if that was your question. Another thing that I didn't mention was underarm for excessive sweating. That is a very good treatment to treat with Botox if you have sweaty hands, sweaty armpits. That is quite popular for the summer. Popular for brides and brides party for your big day. It's having injecting the sweat glands to that area. It's actually super nice because you will have no sweat patch coming through your clothes. So that's super popular as well. I know some people will inject feet for sweaty feet, but I've never had the pleasure of doing that yet. So yes, I mean, therapeutic purposes. I think half of the question, yes, absolutely. I mean, yes, you can have Botox at the same day as a consultation. Yes, definitely. It doesn't take that long. I think consultation is quite lengthy because there's a lot of chat, there's a lot of explanation. I need to listen to you and I need to know what your expectations are. So, but actually the injection, the time of that doesn't take that long. So, I have a few minutes left. Anybody wants to ask me questions? I'm just thinking about other things that I haven't explained. Frequent asked questions would be, I mean, I also would, if you've never had that before, you're most welcome. If you've never had that before, if you never had Botox before, we will start really gentle, and it's nice to come and have a follow-up. This is one of those very important people ask me, do I need to come for a top-up? Now, here is the deal with a top-up. I don't like to call it a top-up because I think you need to be injected properly first time, and you need to do a great job first time. So, you know, we don't do a half-hearted job and then 2 weeks later we just finished what we started. And I don't believe in that. I would say it's important that the injection, you know, at your initial treatment session that you are injected, maybe perhaps when it's your first time, I think it's important that perhaps you're starting gentle and have a follow-up 2 weeks later. But in terms of people who've had it and are used to having Botox, when I chat with my patients first time and I get to know what they want and get to know them, I'm hoping that I'm going to deliver what they want in your first session. But then again, you know, if there is a problem, if there is anything that you need to tell me or show me, then it's important that it's done at exact 2 weeks, between 2 to 3 weeks, so it can be addressed. 30, would you advise? Yes, for sure, definitely. And I think when young people, for prevention, decide to have Botox, it's an amazing thing. And I think when you start at that age, I was 27, I think older you get, you just don't need that much treatment. You don't need that much Botox. You can still have maybe once or twice a year, so very little. And also there are some 30-year-old or 25-year-old or 27-year-old who has a very strong frown line, and they frown really strongly. So it's perhaps not to do so much with age, sometimes is how your muscle moves. So that's something that is very individual. I am super proud of myself because I think I'm getting the hang of this. I was super nervous last time. And me and Rapunzel want to say thank you so much. I need to wash her face before my 6-year-old find out that I've been drawing on the face. I will be in trouble. So I'm going to leave you and love you and leave you, that order. And I'll see you on Thursday for another question time. Thank you.